Welcome from Berlin. Welcome to the GOARN 2020 session at the World Health Summit, 20 years of the Global Outbreak Alert and Response Network. My name is Joanna Hannefeld. I'm the head of the Center for International Health Protection at the Robert Koch Institute, which also proudly hosts the world's first GOARN CC. We have a fantastic session today where we'll be reflecting on the network, but very much doing so at a moment when its mission and its activities are more important and vital than ever before. But before we move to our very distinguished panel and have exciting questions, it's my pleasure to introduce my co-moderator and co-host for today, Professor Dale Fisher. He is intensive care physician at the National University of Singapore. He's also a GOARN steering committee member since 2013, and he will share with us some of his reflections on the GOARN network. Dale, over to you.
Thanks, Joanna. It's my privilege to co-chair this meeting with you and to engage with these 7 wonderful speakers that are lined up for us. But I would like to acknowledge Robert Koch Institute at this time. As you mentioned, they're GOARN's first collaborating centre and continue to make remarkable contributions to GOARN, including, of course, organising this session at the World Health Summit. So also, as you mentioned, this is GOARN's 20th anniversary. It was brainstormed by others, including Mike Ryan in the panel, who's in the late 1990s and became a thing in the year 2000. And at that time, there were 60 network partners in that first year, and that's now grown to over 260 now from 80 different countries. There's big agencies, there's NGOs, there's UN agencies, national government specialized public health institutes, there's academic institutions, networks, even hospitals. It's you remember it was built on the premise that not everyone can do everything, and as together we can as a network. We've deployed over 3,500 people in 90 countries to over 150 events, and this is in all disciplines: epidemiology, surveillance, laboratory, case management, IPC. But we continue to evolve. After well over 1,000 deployments to West Africa for the Ebola outbreak, we embraced a new approach, which we called GOARN 2.0. And that was so that we could broaden beyond just response and look at alert and risk assessment, operational research and tools, training and rapid response capacities. And even more recently, we've started the potential of moving into preparedness before to assist with readiness activities with other components of WHO. So all these efforts are done under improved governance with a 4-yearly cycle and 2 yearly operational planning, including transparent operations, and we're just creating a strong monitoring and evaluation framework. So through this year, COVID has of course been a challenge for us, like everyone, but we have adapted. We've coordinated some major missions, provided in-person and virtual support to member states, and innovating in research and training, particularly to support the global response. Our steering committee now meets monthly to help maximise the input that GOARN and its partners can provide. I guess in parting for this opening, I don't think anyone would be really pleased with how most of the world has responded so far. There's certainly good parts to the response, but largely there's been plenty of areas for improvement. I remain optimistic that we can do better, that capacities can be improved, and we need to move from that reliance on lockdowns and border closures, and indeed live with the virus rather than waiting for a vaccine that doesn't even exist yet. I've got high expectations that the speakers we're about to hear from are going to enlighten us to this regard. So with that, thanks again, and I'll hand back to you, Joanna.
Thank you so much, Dale, for for sharing a bit of the GOARN approach and also the network's history. So it's my great pleasure now to begin our panel. We'll have 2 rounds of questions, but there'll also be an opportunity for people to ask questions from the floor. So if you feel a question coming on, please do put that in the chat. In beginning our discussion, really, what can we learn or what must we learn from GOARN support for COVID in the past 9 months for addressing the pandemic that will unfortunately be with us for the coming year or years? And it's my pleasure to go to our first speaker today. He doesn't really need an introduction. He's the director of the WHO's emergency program, and I think a hero to many of us in the global health community. Mike Ryan, over to you.
Mike, you're on mute.
Okay, I'm not. I'm okay again. Sorry. Sorry. Thank you, Joanna. Thank you, Dale. It's really good to be part of this celebration today, even if we are facing a terrible situation collectively. And I am proud to be a Gornie, as they say, and to be someone who's worked with so many other institutions and people around the world on this. None of this would be possible without the people who keep this whole thing running. Certainly the operational support team for GORN that's been around since GORN began, and particularly Pat Drury in his leadership role in driving this collaboration around the world, and the team that work with him here in WHO and in other institutions. Also to those institutions who, like Unicef, who seconded people in here and worked together as a team. So I think GORN represents the best of what we are. The guiding principles that were established in GORN in 2000 still stand today, and anyone who wants to should go back and look at those guiding principles, but they're essentially based on the idea of no one institution has all the capacity. We knew that 20 years ago. What we felt, and I think what we all believed, is that each and every institution and organization around the world, if we pooled our resources, if we pooled our scientific and epidemiologic, laboratory and operational capacities, we could make a difference. And GORN has made a huge difference around the world in so many different situations, so many different epidemics and other types of emergencies. So I'll hand back to you, because I think I'm just so pleased, so proud of all who've worked to make this network, which has lived with very little resources. The fuel of GORN has been the passion, the commitment, the courage and the professionalism of the people who've made it work. And we need that courage, we need that passion, we need that professionalism, we need that coherence, we need that solidarity more today than we ever have in the past. Back to you.
Thank you, Mike. And that's central already to the GORN idea and how that has helped in addressing this pandemic. So it's now my pleasure to move to our next distinguished panelist. That's Dr. Rebecca Martin. Dr. Martin is the director of the Center for Global Public Health at the US Centers for Disease Control. Dr. Martin, over to you. What can we learn from the past 9 months for going forward and addressing this pandemic?
Thank you so much. And as Mike Ryan mentioned too, it's an honor to be here with everyone today to celebrate 20 years of GORN partnership, and something that we at CDC have strongly believed in and been part of. And I think there are many things going forward, very exciting opportunities in this. In thinking about what we need to learn, I think one thing that is very important is the fact that we realized, and we knew this before, that no one country is adequately prepared for what was to come. And we recognize that there may have been some expertise in some areas, but not in others, and that we truly needed to come together to make sure we had sufficient national and regional capacity to coordinate and support. And that comes through these partnerships. The need for that, having that surge capacity was very important to be able to go in to help, to respond to the outbreak, to do the investigation, to be able to do the contact tracing, to be able to understand what mitigation measures, and then the importance of using data in real time to be able to make decisions as they move forward, not trying to do things after we see them after a year, but how do we have that real-time data to make changes in what's needed for testing, for isolation, for the contact tracing, and for outbreak follow-up. These were very important efforts. And also, I think the important thing that was mentioned early on is not only looking at response, but also looking at preparedness. As we knew, as it was moving through continents, the importance of other continents getting ready and countries being prepared, and the value of GOARN being part of that in looking at country preparedness and what was needed and helping countries to get prepared was critical at that time. Thank you.
Thank you so much, Rebecca, for that intervention. And already quite a few points you mentioned there, the contact tracing, the real-time data. So there are many things, and also the focus on preparedness. So I'm going to move from the Center for Global Public Health in the US to the director of the Center for Global Public Health in China. It's my pleasure to welcome Dr. Xiaoping Dong to the discussion. Dr. Dong, from your perspective, what have you learned from your responses? What should we take forward as we move forward in addressing this pandemic for the coming year? Thank you.
Thank you very much. And hello, everyone. And for this, question, I would like, have such comments. First of all, China, comparing with, our partner countries in this area, is just at very beginning stage. Although we joined some missions, for example, not only infection disease, but also some natural disaster in the Indonesia earthquake, as well as in the 2014 and 15 Western Africa Ebola emergency. We're still at the stage to learn something from you. Of course, I personally believe that the GOARN mechanism, working mechanism, is a wonderful mechanism, and the umbrella of the WHO and also other international community to help other countries, other regions, other peoples who need help. And through the efforts inputted from different countries, different experts, we learn each other, we work each other, and we get sort of successful in fighting against the infection disease and other natural disasters. And what I want to emphasize is through such kind of working mechanism, we can get some common consensus dealing with the common enemy, for example, the COVID-19 epidemic and SARS-CoV-2 virus together. And I personally participate in the fight against Ebola in Western Africa for a couple of months, working in Sierra Leone. And through this battle, what I learned is most important things, we must work and common comprehensive, a common concept together, and then get win the battle finally. So for COVID, of course, China dispatched the different teams, different experts, whatever in them under the umbrella of GOARN or not, to different countries and sharing our experience or even lessons to different countries. So China CDC and our center would like very much happy to join this meeting, as well as to join the GOARN teams to working together with other experts from different countries together, and then to get our destination. Thank you very much.
Thank you for that perspective from China, Dr. Dong. And it's my pleasure now to move geographically again to Africa, to Senegal, and to introduce the next of our distinguished panelists, Dr. Amadou Sall, who's the director of the Institut Pasteur in Dakar, and to really put the question to you, what have you learned, or what can we learn from your having a sort of different perspective, I guess, or a different starting point to look at what can we learn from how COVID has developed thus far for moving forward over the next year or two in addressing this pandemic. Dr. Sal, over to you.
Yes, thank you very much, Joanna, and thanks for having me. It's a great pleasure to join this important discussion about what we've been doing and where we're going from now. I think I want to emphasize 3 important points that GOARN are really showcased during this epidemic. I think number 1 is people are very surprised about how Africa is behaving with these epidemics and whether we have been conscious about it, but GOARN has played a tremendous role in the preparedness part, meaning that Africa has been hit lately, but between the beginning of the epidemic in other countries and the time it happened to Africa, there are a lot of discussion about understanding the best practice in terms of alert and preparing country. And the discussion we have within the partner has been extremely instructive and helpful. If we look at the second point I want to raise, which is more on the response, we have also to give credit to GOARN for spending a lot of time into actually building local capacities through amazing training program, not only about technical issues, but being multidisciplinary and working together, which is for me a key secret. And when we talk about Ebola epidemics in previous or yellow fever or different epidemics that happen in Africa, this has been an opportunity to cooperate not only between partners, but between countries, which has been really key for success for what people have been doing. And if we look at challenges like the testing, deploying lab in different places to make testing available, this has been one of the major challenges. We really have got some sort of rehearsal over the time that we've been working with different partners to make that happen. So these are the things that I think very important. But the last point I really want to emphasize, which to me extremely important, is the coordination aspect. I mean, we have been having with all the different partners, which is something that also we do on a regular basis with GOARN, and which is a secret for me if you want to build a future. So just in one word, the value of partnership and how by partnering we can be synergistic has been for me extremely important to support and the response here and the preparedness. Over to you, Joanna.
Apologies, I took a bit of time to unmute there. Thank you very much, Dr. Sai, for those concise words on and also for referring to the idea of GOARN, the essential idea of a network that is really built on the idea of partnership. So it's my great pleasure to now move to Dr. Michaela Serafini. She is with MSF, and there she currently leads the task force that looks at the access to COVID-19 tools. So maybe a joint perspective on humanitarian responses and the development of COVID tools. Over to you, please.
Thank you, Joanna. It's a pleasure. It's a pleasure to be in the summit. I think it's a very important event and a very important event in 2020, especially with this pandemic going on. And thanks to GOARN for inviting me for this special session, 20 years of GOARN. MSF has been probably since the beginning, very proud of constructing this as we go. It has been a learning curve, and we are happy for having been there since the beginning and continue this collaboration that one way or the other will continue to improve as we go. When it comes to GOARN support, the 9 last months and what should we carry over for the coming years, I think that one important thing that after this 9 months we might have to take a little bit over is, I mean, we have measures that are evidently were very well supported. Now the idea is how do we try to continue making those local, making those specific, making the communities being in the center of the decisions, taking into account their cultures, taking into account their economic situation, and taking into account their public health systems, and try to tailor the response to it. We do know that not all, I mean, that there's not one bullet that will fit everyone. So continue to try to explore that specificity of a specific place, geographic context, so as to have a bigger impact when it comes to controlling the outbreak. So that's my first point. I think the second one, and also goes along with this 9 months of experience through the pandemic, I think that we need probably in the next year to pay attention to those that are falling through the cracks. There are people that are not necessarily included into systems. And when it comes to access to medical products, COVID medical products, I think it becomes quite evident most of the mechanisms that are put in place today, either multi-agent mechanisms or initiatives, either regional or national initiatives, are very much oriented to national systems and to governments. And what I'm trying to say here is those falling through the cracks are generally the ones that are stateless, the ones that have a legal status that is a little bit in the gray zone, or those minorities that might not be prioritized by their own countries. So I would, in the coming months, will try to focus into those so as to include them in the mechanisms that are today in place, twist them in such a way that they are included, or try to create a mechanism that will take those into account. And when it comes to medical products, again, the equitable allocation framework that has been drafted, and it's today part of the response from WHO, has put into words this idea of taking into account refugee camps, internally displaced people, ethnic minorities, political minorities, and try to build a mechanism that will one way or another guarantee access to the new tools coming in, including vaccines. So I think it's just paying a little bit more attention to those that are falling through the cracks and try to include them in the system so as to have and gain the access that they deserve. So those are the 2 points, so really being local specific with all the evidence base that we have today. And the other one is really paying attention to those that are a little bit left aside. Thank you.
Thank you, Michaela, and very interesting to hear about also the equity dimension of COVID, of course, and how important that is going to be going forward. So it's my great pleasure to now move to Dr. Emanuele Copabianco from the International Federation of Red Cross and Red Crescent Societies. He's the Director of Health and Care there. Over to you, Emanuele.
Thank you very much, Joanna, and a good morning, good afternoon, good evening to everyone. 2 years ago, I was sitting in Berlin listening to the unforgettable Peter Salama. And Peter Salama, at the beginning of the outbreak in North Kivu, Ebola outbreak, said we're living an epidemic of the virus and an epidemic of fears. And I think when he said that, he really pointed to what would have been in the next 2 years one of the most difficult challenges to overcome the fears and bring the population, at least part of the population, with the response. He put very much on the spot the importance of risk communication and community engagement. And I think over the following 2 years with UNICEF, we put together a social science cell with CDC and IFRC that work together on the feedback monitoring systems. We really built a response that was based on people and listening to people in communities. And when COVID hit, I think this has been put forward from the very beginning. And I'm very, very happy that over the past few months, we have been able, thanks to the support of GOARN, to launch a risk communication and community engagement collective service that brings together UNICEF, brings together WHO, brings together IFRC and more partners to really try to elevate the importance of risk communication, community engagement, increase coordination, improve evidence in this area, and strengthen the quality and consistency so that countries can be better supported in engaging communities, as Michaela was saying, this being critical. So I'm very happy for this support, but we are seeing that the results of it is not there, not in all places. In many places, we don't have the right communication in place. In many places, we have riots at this point in time. And if we look ahead at the next 9 months, I see two main challenges: is bringing back the test, trace, isolate, and making the center of controlling the epidemic. And on that, you need communities to be engaged. You need people to be able to participate in this effort. So we need to follow the virus, not the people. When we do contact tracing, we need to support people that are in quarantine and isolation, and not only going there with a punitive approach, but a much more supportive approach on the psychosocial side and on the material side. And so this will be absolutely critical. Adherence to public health measures will rely very much on proper risk communication, community engagement. Second challenge that I think in the next 9 months is potentially the deployment of one or more vaccines. Vaccine doesn't mean vaccinating, and so you may have the supply, but you really need to build the demand that is able to welcome that. The challenges will be enormous due to the rationing of the vaccine, the challenge that we can only imagine. Again, investing in communities will be critical. Epidemics are not ended through biomedical interventions. They are won through people, and that is, I think, a key message that GOARN has been pushing forward, and we'll all try to work with in the next few difficult, unfortunately, months. Thank you.
Thank you, Emanuele. Certainly, community engagement and risk communication is we can see, obviously, is becoming an ever bigger challenge, really, in addressing the pandemic. And so I want to go, this is a good lead-in also to go very much not last but not least, our speaker from Unicef, Dr. Carlos Navarro. It's my great pleasure to introduce you, the Principal Advisor for Public Health Emergency. Carlos, are you with us now?
Can you come on? Joanna, this is Mike here at WHO. In the great spirit of GOARN, Carlos has not been able to connect, but we've got the next best thing. We have Jerome Paffman from Unicef sitting right beside me. So I think Jerome will take the floor to give his remarks from here.
Please.
Hi everyone. I don't know if you can see me or hear me. So my name is Jerome Paffman-Zambruni, and I'm working in Unicef and working directly on a day-to-day basis with the WHO and other partners in GOARN, IFSC, and everyone in the COVID-19 and other outbreak and public health emergencies. Many things were already said, and I want to apologize for Carlos, who is facing some IT connectivity problems. Many things were already said. I want to highlight 3 points. The first one, I want to highlight the GOARN as a network of partners, which is a safe space for discussing and coordinating. I think there is some specific moment, including the weekly operation call, with that reunion a lot of our experts and organizations and institutions that are part of the response, which allows for everyone to be up to date on the latest information, epidemiology, activities from different partners. And I think this space is critical because it allows rapid reactivity, sharing of information, and to inform our own institutional programming as well as collective programming in countries. So that's a very unique features that GOARN supports, and I really think it has been a key lessons learned. It was pre-existing to COVID-19, but it has been really key for all our different organizations. The second one, and it was already highlighted by Emanuele, I think GOARN in the latest has been key in bringing us together for this, for raising collective awareness and raising the importance of community engagement as a key and central component of outbreak response. Medicalized approach, public health response are key, of course, but we don't respond to outbreak without communities. The communities need to own the response, and I think the collective services that was created through with the IFSC, UNICEF, and WHO with the support of GOARN is a key milestone in advancing on community engagement as the basis and the initial foundation of all outbreak response. And the final point I wanted to raise as a key support and contribution from GOARN, from a UNICEF perspective, but collectively as well, is the capacity to make expertise available for all of us, not only for our own organization, but this is a huge network, and very often it goes through WHO. That is true, but it's not only this, and it's really a diverse network of organizations from the north, from the south, from the east, from the west, from everywhere, that can bring their own expertise and create this collective expertise. And I think we need to invest more and more in these features, so everyone in the world can benefit from this diversity of expertise that GOARN makes available. Over.
Thank you, and also thank you for the very insightful advice when just joining us at the moment. So I think we had a wonderful collection of reflections and insights from the very different perspectives, geographically, but also institutionally, that make up GOARN, and that also show a bit about the way that the response to the pandemic has gone. We've heard about the importance of community engagement. We've heard about the role that GOARN has played in a way in preparing through the engagement over time, but also in providing this trusted space for engagement, for exchange of information and sharing that really sort of seems to capture the spirit of the partnership. So thank you already for a very insightful round of comments, and I'm going to hand over back to Dale to see if we have some questions from the floor.
Thanks, Joanna, and thanks everyone. The short answer is we'll lean on questions. So if anyone has questions, you're very likely to get up. The first question though is from Stefan Elber, who says, and I'll pass to you, Mike, first for this response if you can. How are investments in emergency operations centres helping to coordinate and improve the international response to COVID-19?
Thanks, Dale. Well, I think many of the GOARN partners actually act as national EOCs within their institutional frameworks at the national side. So there's a real positive interaction here between GOARN partners and this role. The Public Health Emergency Operations Centre network has got stronger and stronger. There is no question that when you bring together data gathering, information sharing, analysis, and risk assessment and risk management within a centre, it's really helpful. I think what we've learned as GOARN partners in the field is those sorts of platforms need to be inclusive. They have to include government, non-government, international, national agencies and authorities. So EOCs are a profoundly important platform, and if we connect EOCs around the world, we make a huge difference. But those EOCs cannot become in themselves silos for information and decision making. So how do we make sure we have command and control and that concept of incident management and emergency response frameworks that are well planned and implemented that still remain open and inclusive, and as Emanuele and Jerome have referred to, and Michaela as well, how can we stay focused on serving our communities? How can we stay focused on avoiding putting aside organizational rivalries at national and international level and focusing on the people we serve, leaving aside our needs to publish, our needs to be visible, and really putting the idea of how we serve communities and the collective service that UNICEF, Red Cross, WHO and others have put together is a fantastic example. So yes, EOCs are very important, but EOCs are either seen as pieces of real estate with technology driving them, or they're seen as places where people gather to share information, to share accountability, to share decision making. And if we see a vision of EOCs being much more about the human component of bringing people together, then I think we can move forward very successfully.
Thanks, Mike. Would any of the panelists like to add on to that? Rebecca?
Thank you, and thank you for that question. Just to build on what Mike said, CDC, we've spent a lot of our efforts in capacity building and partnering with countries to build emergency operations centers to address and to be prepared. started many with Ebola, recognizing, as Mike has said, the need for the command control when you have national, but then you bring on also international partners as well, how to have that coordinated and be led by government, and to be able to be coordinated. And as Mike said, if it really is bringing the people together as a whole of society, so bringing together not only ministries of health, but all the different ministries, but other sectors that are needed, community representatives, civil society, this is really the opportunity to do that. And we've seen when the whole of society is brought together and data are used to drive and to make decisions about how to plan, where to target efforts, it can be a very, very powerful thing. But it's not, as Mike said, it's not just the equipment and it's not real estate. It has to be about people coming together in a command control. And when we see that happen, there has been great effort and great success in being able to make sure that the data are used to drive responses and also to plan. Thank you.
Thanks, Rebecca. So my offer has been taken up by several people now. A good one from Gail Carson, who's the Deputy Chair of the GOARN Steering Committee. Thank you for emphasising the need and key role of community engagement and communities in response. Some countries are seeing a decline in compliance of the COVID-19 measures, which differ across the country. How would you improve that engagement? What could GOARN do to help? Thank you. So many of you have discussed the importance of RCCE here, and clearly the countries, particularly in Europe and the Americas, there's a lot of resistance, I guess, to continue with some of these measures, and I guess I wouldn't have seen RCCE coming as a problem in all these developed countries. So can we take the pressure off the politicians and government and public health agencies and say, no, this is a good thing to do or something? Maybe who'd like to start? Maybe Jerome, you are RCCE?
Well, I'm not specifically RCCE, but I'm happy to take this. I emphasized a lot on the importance of community engagement. I think what I read behind the question is one of the key challenges that we are facing, and we've been facing in all outbreaks, not only in COVID-19, is how to sustain the community engagement and trigger behavior change when in the long run and in over a long period of time, when these measures and these public health measures are very difficult and change the day-to-day life of communities. I think one thing I would like to share here is maybe a way to reverse a little bit the consideration and not to look necessarily on how community needs to continue to be engaged and change. That, of course, it is key and important, but I want to also emphasize on the importance for the public health response to be responsive to the community perspective and needs. What you can expect and the content of the public health measures that you can establish at the beginning in a short period of time are not necessarily the same when you are looking in the long run, in long period of time. And I think it's very important for us as public health practitioners to be receptive to community needs and perspective. I think that's one key features of the work that IFSC, WHO, and Unicef is doing, is to bring more and more community feedback, community perspective, so the public health response can be better adapted and to community needs. And I really think this is a key feature. We need to make sure that not only we're looking for the adherence of the communities to public health measures, but also that public health measures are adapted and tailored to the needs of the communities. Over.
Thanks, Jerome. Anyone else like to take that? I'm thinking of you, Emmanuel.
Yeah, thank you, Dale. The magic word is trust. And I think to ensure that people follow the measures that are being suggested, that trust is critical. And trust is not built easily during an emergency. It needs to be there before. And if it's not there, can be won. But as Jérôme was saying, the first step is really listening and responding to that feedback. And that's where I think the investments that many of our agencies are doing in community feedback systems is critical to show that what is being raised as a problem is being responded to, and that builds trust, and I think brings in compliance. The other thing that I believe is critical is simplifying the message. And at the moment, you have too many messengers and too many messages. There is a necessity to simplify communication, and and these cuts across. I mean, if I look at the epidemiological situation and I look at my own country, Italy, we are bombarded, we've been bombarded for months with numbers that are the numbers for the entire country. It's very difficult for the common citizen to understand what is happening in its own local community. Am I red? Am I yellow? Am I green? Can we bring that simplicity so that people can recognize that if they actually do with their neighbors, bring those measures in place, they will actually move from red to green or to yellow, and they will be much more engaged into the response. I think that simplification of tools to bring people together is critical, and there is a role that all of us, I think, can play on this. Over.
We've got a couple of questions. This might be the last question, but I'm going to bundle them. There's one from Charlie Six in Germany and one from Sharon Salmon in Wipro. It's about the major agencies and how they've responded to the pandemic, particularly when it went home, it's put here. So I guess it's how did you balance the national and international responsibilities? So I might ask Xiaoping, did you want to comment on that, and maybe Michaela, Rebecca?
Thank you very much. And what I want comments on this question perhaps, and yeah, well, of course.
You're not really very clear, Xiaoping. You were clearer before.
Okay, can you hear me?
It's a bit quiet. That's a bit better.
That's better?
Oh, that's very good.
Can you hear me?
That's perfect.
Okay, thank you very much again. Well, I tried to reply this question because yeah, we met such situation when in the beginning of January and February. At that time, of course, we had no time to pay much attention to the international. And now the situation in China is much better, or we have just a couple of cases, imported cases each day, and we have more time to think about the international, of course. And that's a very big question and very difficult question to answer because different countries has different situation. And in China, and what we did in the past months to supply the international supporter is, of course, China is a huge country. We have a lot of different hospitals and different CDCs, and we have 4 CDC systems. So totally, we have more than 200,000 public health doctors working in this field. And of course, we have the balance quite well about the national situation and the international situation, particularly on the field of our neighbor countries, for example, in the South and North neighbor countries. And what I want to suggest is every country who has such capacity has to prepare them firstly very well to keep the resource for national and keep also another resource for international, because everybody knows if our neighbor is unsafe, we will feel unsafe. So this idea was gradually deepened in our brain for Chinese public health doctor, deep and deep. So we are willing to join the international committee to supply our contributions to our neighbor country and even the country far away, for example, the African countries. So prepared is quite important for us. Thank you very much.
Michaela, I guess MSF doesn't really have a home country, does it? But it's got national and international obligations.
Exactly, exactly. And it has been very difficult. I mean, we have been stretched in all corners. And here we're speaking about intervening in high-income countries and in low-income countries. This means also from ICU, very specific units, to supporting in outbreak response. That means restrictions of movements everywhere. So our staff couldn't go to the places they should be, and our stock couldn't get to the places where there should be. There's also this idea of technically you're moving from very high technical ICU mechanisms and technical capacity to care to sensitization into the community. So it has been really very, one way or the other, very tough to move in all fronts, with the impossibilities and with the big impossibilities of scarce of human resources, scarce medical tools. I think that, again, we are getting into a new normal. I hope that this is not the new normal when it comes to outbreak response, but we need to get used to, and the flexibility that this organization has to have to be able to respond differently everywhere, I think has been put and exposed to its best. There is, and I am afraid it will continue, there is a certain fatigue that we will have to tackle one way or the other. People are getting tired because that is touching their own health, I mean, their own family, and it's touching the ones that they're assisting. And there is a point, there is frustration. So there's a lot of accompanying our staff, accompanying our organization in trying not to, I mean, in trying to debrief, but not necessarily give up. So as I say, it has been a challenge. It will continue to be a challenge. There's a lot of energy behind, there's a lot of passion behind, but there is a lot of restrictions that we will have to overcome. And I think the GOARN has helped in that, because the restrictions we might have, others might not have, and the idea of coordinating and interacting has helped quite a lot.
Thanks, Michaela. Okay, Rebecca for 1 minute, Emmanuel for 1 minute, then we've got to close.
Thank you, Dale. Just quickly, I think as Michaela said too, staff are stretched, but within our response with that CDC for the US, we have an international task force that is dedicated to the global work that we do, and we have dedicated staff working with that, and we have designated certain people to be the leads and to be the deputies, and we rotate them. So they're on for 30 days and then they're off for 60, so that we have ability to get people time to rest, but at the same time, we have the continuity and the cohesion of our work. In addition, we have staff in countries, in over 60 countries, who are working directly with ministries of health and other partners, and many of the organizations here on the panel today as well, who are working with governments to help respond to the pandemic. And then lastly, my point would be that we also make sure that we are communicating and exchanging information regularly with countries, so that we can learn from other countries and to bring those best practices of how we can help fight the pandemic in the US as well. So it's multi-pronged, but we're definitely ensuring that we have the domestic and also responding internationally. Thank you.
Thanks. Emmanuel?
Thank you, Dale. The Red Cross is present in 190 countries, so we are very local. And I think what we have been hearing over the past several years was the localization agenda. And I think we have been talking about localization agenda, but what COVID-19 has pushed all of us is to recognize that the response is really local and has to be local. And I think what we are seeing is a shift now in that direction, which is welcome, which I think would be critical for the future, as investment, particularly for preparedness, would have to move closer to the respondents on the ground to ensure that the capacity is strengthened for quick response. In this sense, I think COVID-19 has been helping an agenda on localization that have not been moving fast enough over the past five years.
It's interesting how preparedness is still so important in the middle of a pandemic. It's real. Okay, let's move to the second question now, which will be, I'll ask you to answer first, Mike, again, and we'll give each panelist a couple of minutes to answer it. It has been touched on fairly significantly in the first question, actually. So I think this might be more about going forward. So the question is, how has the GOARN idea of partnerships helped to address the pandemic in different settings? And where do we need to do better? And as I say, I think we've kind of touched on what it's done so far. So really, this could be focused on where we need to do better. Mike?
Still, no, as you said, it's always possible to do better. I think what is admirable, and you've spoken about it, is how GOARN has broadened out. I mean, when we first started GOARN, it was really focused on making sure we've cast our minds back to the pre-2000s. What would happen in an epidemic in the field was everyone would arrive with good intent, and then we would spend days, sometimes weeks, working out who was going to do what, sometimes fighting amongst each other, sometimes, not having a functional relationship with local government and local communities. GOARN was established on a principle that we needed to work together, put aside differences and do the maximum together. That did not mean merging organizations, not creating new entities, new structures, and new rigidity that would actually decrease the mandate of individual organizations, but it was about aligning our organizational efforts. It was about seeing the pieces of our work that could be done together and enhanced together. I think we've seen that come strongly together around the expansion of GOARN, purely away from the public health model of surveillance and containment into a community-centered model built around social engagement, built around social science principles, and moving into social science, not just the science of epidemiology. I think we need to also now, I think, and GOARN has already moved in this area very heavily, is in the area of training, in the area of vocational development, ongoing learning, and the transfer of technology and the transfer of knowledge between institutions, that exchange of knowledge. And I think GOARN can do much in this space, standardizing what we do, making sure we have a global health emergency workforce that works, making sure that skills are interchangeable between countries and we can move resources around, people around, within countries and between countries, in a way being able to have a tactical reserve capable of responding and supporting each other in response. GOARN has underpinned many of those principles in the past, but clearly needs the investment. And I said this before, Dale, GOARN has operated on fumes. It's operated on tiny amounts of money relative to what it's achieved. And I think the world's community need to look at what GOARN has delivered as a partnership with very little top-line investment in its functions. So I do think what we need to do better is invest in GOARN as a platform, invest in GOARN as a partnership, invest in the north-south part, but I think we need to learn lessons better from the south. I think if we look at Asian and African countries, they've led the way in this response. Why have they led the way? Because community-based interventions, surveillance, the instinct and muscle memory to do case finding, contact tracing, to look at trying to suppress and control infections while engaging communities in larger measures to continue to do that. And I think actually GOARN needs to learn, and not needs to learn, but we collectively as GOARN partners need to understand that the transfers of technology and knowledge are no longer north-south. They're north, south, south, north, west, east, east, west. As Jerome said before, this is a 4-point compass. Learning and knowledge moves in all directions. And I think GOARN has always embodied that, but I think it could move to further embody and increase its representation around those issues. Back to you.
Okay, thanks, Mike. Who wants to follow that? Perhaps, does anyone, let's go to Michaela. You spoke earlier about people falling through the cracks and things like this, and they're not really necessarily in a jurisdiction that really, I guess, is giving them the attention they need. How can GOARN help there?
I think, and we are already looking with GOARN, with WHO, how those that are left aside could be included in the very specific of access to COVID tools. And there we're speaking about diagnostic, therapeutics and vaccines. The idea is to create a kind of a mechanism and humanitarian buffer stock that could be devoted to those that are not necessarily included in systems. So I think it's something that is being constructed, being thought about, and I hope that that one day we will have a simple system that will include them one way or the other, and they will benefit from what the world is benefiting from. But maybe if I can, going back to GOARN and partnership, and as I was saying before, I think that MSF has been there since the beginning, and it has been a learning curve. And the most difficult thing for MSF is really trying to coordinate. I mean, the role of coordination, the role of collaboration, and even complementarity that GOARN is trying to bring in, I think is essential. What has been more difficult probably for MSF was this idea of continue to be part of the full response, but maintaining that identity that makes us MSF, medical and outbreak response, and how can we be embedded in a response, but on the other hand, the trust that we have been building with community continues to be the trust that MSF and the community has one with the other. And that has not been easy. I think that the second point that I want to highlight, and it doesn't come so much in terms of COVID, but yes, in the last Ebola outbreak, happily, there were plenty of actors. Happily, there was a lot of technical capacity. Happily, there was a lot of operational capacity. And that was something very, very good. And in that outbreak, as MSF, we were assigned one way or the other to, or be in charge of the Ebola treatment centers. And that was great, is our comfort zone, is what we know, and that is really what we were meant to do. But in that response, and with the speed of matters happening, we forgot to connect with the other ones. So GOARN was contributing, GOARN was coordinating, but we forgot really to look outside the Ebola treatment centers to try to understand what Unicef was doing and sense the temperature of the community, so as to afterwards come back to our Ebola treatment centers and adapt what was coming from the outside to what we had to do in the inside. So it's much more of a lesson learned from MSF when it comes to collaboration, is even though we have a specific niche, let's really be connected with the others to try to understand the full chain of aspects and not necessarily work in a silo approach. That will have a much better impact in the timely response and the impact that we are willing to have when it comes to outbreak response. Thank you.
Thanks, Michaela. I guess that might be a good segue to you again, Jerome. Talking about coordinating with UNICEF.
Thank you very much. No, I think I mean, many will raise different points. I want to raise one in how we can maybe improve collectively through GOARN is to continue to look at our programming and our modus operandi when we respond to outbreak, taking into consideration how much outbreak response can generate social inequalities. I mean, something that we're learning more and more is that an outbreak response is not socially neutral in the communities. So it does generate and create inequalities in access to the public health response on one hand, but also considering all the socioeconomic impact of outbreak response. What I think is going to be key moving forward is to make sure that we integrate more and more this equity lens in our outbreak preparedness and response, including through engaging further. We started on this, but engaging further in integrated multidisciplinary outbreak analytics, which brings together, as Mike was saying, on one hand, the AP biomedical analysis, but also social science and also all the existing research and community feedback to bring all this together, so we have more real-time information to inform programming that then can be better adapted to community needs. So just wanted to flag this as a way to move forward. It is started, and it's not saying that that's not something existing, but that I think something we need to scale up and to look at it collectively, as this pandemic is also telling us that social inequalities is central, unfortunately, to outbreak response. Over.
Yeah, it's interesting the fact that this outbreak will go for so long. We do have time to see how things have gone, reflect and start doing things better. So sort of after action reviews midstream, I guess. Amadou, welcome back. You mentioned before about some of the importance of coordination and things like that. So how can GOARN do things like this better going forward in this pandemic?
Yes, thank you very much, Dale. Definitely coordination, and Mike and everybody has talked about it. I just want to emphasize my 2 minutes on a couple of important issues when looking forward. I think one thing on which GOARN has been good but not developed enough, it has been innovation. I just want to take the example of GoData, which is something that has been sought by people that know the field and build it and make it operational and make it used by people. I think it's a great example how through collective intelligence, people can collect information and bring tools that are useful to everybody. I don't think GOARN, when it comes to innovation and technology, has done that much. And I think this is something extremely important to have in the future, and where GOARN need to put some brain and investment. The second aspect is one of the major challenges that we have when coming to Africa during this epidemic, and Michaela mentioned it, the access to COVID tools, like diagnostics, like therapeutics. And this also in Africa has resonated in a real need about building capacities, including industrial and local manufacturing. And for that, I think this is not the sort of partnership that GOARN is good at or ever been interested in. I think when we talk about building capacity, we are focused on human resource, on transferring knowledge. But I think more and more GOARN should bring some sort of set up a forum or find a way where partners that have this industrial capacity would help others to build their own capacity, or bring different partners that can support that, because that's what we have been facing for diagnostic, for treatment. And it's just because it does not exist or there is no way that people do it. And the last part is really the research. I have been extremely happy with ISARIC and different research component that has been helpful, because this has helped a lot on deciding on treatment regimes and things. And this is also something I think GOARN should develop more. So these are the key issues in terms of research development, innovation, and there's been more partnership with industry, I think may be very useful for the future. Over to you.
Okay. Perhaps Xiaoping, if you could go next on question 2, how has the GOARN idea of partnerships helped to address the pandemic in different settings, and how can we do it better?
Well, I fully agree with the comment well proposed by above the experts. Well, for example, the increased capacity of GOARN and form more teams, for example, and more human resources and more investment. 2 things I want to add. One is we have to create more chance or more opportunities to practice, because the people from different countries have different culture, they have different tools. So make them together like a team in any time is so important. So that is the first thing I want to address. Second thing is it's better we improve our capacity to communicate with the government, because public health or preventive medicine, if we leave the government outside, we can do nothing. And different country has different governments. So we have to increase our capacity to communicate, to influence the government, to accept the GOARN idea, to accept the GOARN conception. I personally feel it's important. Over, back to you.
That sounds like thanks, Xiaoping. That sounds like a nice segue to Rebecca. And how's working with government going?
Thank you. Actually, I wanted to bring up 5 points here, and some of them build off of what's been said, so I'll be brief on those. But I do strongly believe the need to build capacity, and looking at regional areas. We've talked about the 4 points on the compass, and I do think it's important that regional areas have surged and sustained workforce to be able to surge, and building that capacity is something I think going forward is strongly needed to be able to do that. We've also talked about the importance of engaging community, and I think it's both the national and again looking regionally of engaging a multisectoral approach here, and the importance of community being at the center of that. And not doing that also during times when there are outbreaks or pandemics, but doing that because you need that trust before those pandemics or outbreaks hit to be able to work with communities. So it's very critical, but also bringing civil society and academia and private sector to work with government into that partnership of how to do that. The third would be around the data. Again, promoting and fostering transparency of information exchange for that early warning system, and being able to detect. And I know there was one question in the box this morning also, the importance of data exchange across border and having data sharing agreements. That has to happen with countries, but then allowing that information to be shared so that there can be the early warning systems and also to respond together cross border. My fourth would be the investments in and the commitment to health security and using the voices and experiences from GOARN. Mike's point here again about really the countries that have been able to use what they've invested in health security. This needs to be sustained, and it comes with the workforce, having the laboratory and the epidemiology, and then the emergency operations center to respond. And my fifth would be the point that Amadou made, which is about the research, the importance of continuing to have strong platforms to conduct operational research, but also implementation science of sharing best practices across, again, with countries and how best to implement them in countries. This is something that could be done, looking at how we could strengthen GOARN's efforts. Thank you.
Thanks, Rebecca. Very well summarized. So the final speaker for this topic is Emmanuel.
Yeah, not easy. I will be repeating a few of the things, but certainly the issue of data and science. It's a good partnership that is based on data and science and is making an enormous contribution, should continue in that direction. Second is the issue of human resources and capacity. I think Rebecca has been talking about regional level capacity. It would be very good if the tactical reserve, as Mike mentioned it, could be really made available for the entire network, and in the future, really creating this larger capacity that can be benefited at the level of the entire network. Certainly, from our perspective, making sure that we keep the risk communication and community engagement central part, and this element of the community as really one of the streams for the present and the future. And then maybe linking to Xiaoping, is expanding beyond going into governments, going into media, better connecting into these 2 big poles that are so important when it comes to epidemic control, and somehow that connection, that better communication with these 2 other poles would be probably something to invest on. In what forms, how, not sure, but it's for me a critical priority that I see in many countries. You know, science is there, clarity is there on the right things to be done, but they are not being done because the problems are outside, and we need to break those barriers. And so maybe that there's a role there that we can play. But it's a good idea of partnership, and there is 20 more years to go for sure, even more.
Okay, thanks, Emmanuel. So it's I'll just remind everyone listening in that we are lean on questions again. So you'd be helping Joanna out if you could make some suggestions. At this stage, I'll be handing back to Joanna to field a couple of questions. Since they're not in the actual box yet, maybe I could ask a question and then hand to you, Joanna.
Please.
So RCCE is really featuring, obviously, and that's not surprising. And I'm hearing what we need, but I guess as chair of the GOARN steering committee and working closely with Pat, what does that translate to in what we can do? Is it about enabling partners? Is it communicating? What do we do, and what does the OST actually do? I don't know who wants to answer that. Maybe Mike, you could have a go at that first, and I'll hand back to Joanna. Thanks.
Well, I may be the wrong person to ask, but I think this is about blending really important concepts that GOARN can speak to more and more. GOARN has always been about boots on the ground, shoe leather epi. That's where it came from, that capacity to be in the field together. But that boots on the ground needs to be linked to two things, in my view. Boots on the ground that are linked to solutions in the cloud. As Adamu said, the innovations we need on data sharing, Go Data, the tools that we need for diagnostics, but none of that works. And one of the abject failures in this pandemic response, to be quite frank, has been that central principle of contact tracing. The ability to detect and isolate cases, to quarantine contacts in a supportive way, and importantly, to have communities buy into that. Myself and Jerome here were talking about trust. Emanuele has spoken about trust. This is the ingredient. This is the money you put in the bank with communities. Mm-hmm. Trust is given by a community. It's not taken by the authorities. It is a gift from the community, and it takes years to build that trust, You can't build it overnight, and you can break it in minutes or days. So from that perspective, if we have the trust of our communities, then communities do accept things like contact tracing. They will accept things like supported quarantine. They will accept stay-at-home orders, but they will do that when they see public health and health authorities making ground and achieving success and delivering their economies and their social lives back to them. There has been a great breach in that trust, a great sense, and we need to learn from this pandemic. Where has that gone wrong? But in particular, on our side, my side of the public health equation, contact tracing, the single most important intervention in this pandemic, in my personal view, that has not gone perfectly well, has been that ability to have contacts quarantine in a supported manner. Mm-hmm. That is where we've lost the game in many cases, and that has testing, tracing, it has all kinds of technological issues. But the outcome of that is potentially infected individuals in our communities, and the result of that has been lockdowns that separate people from people everywhere, rather than our capacity to identify those most at risk and have them quarantined in a supported way. We really need to look at that. So for me, if we think about the magic combination, it is that shoe leather, on the ground capacity to do public health intervention, linked to empowered communities who trust and accept and are supported in absorbing those interventions, and then using those innovative tools to increase our performance, the data sharing, our speed of our fleet of foot, how quickly we react and respond, and how we can continue to build trust in communities. So there's not one answer, Dale. The community is central, but you have to pull together a blended approach. GOARN is fantastic. because GOARN is one of the few partnerships globally that actually blends those different types of conceptual approaches to the containment of epidemics.
Thank you very much for that, Mike. And we have some questions following up from that in the chat. And I asking also about how can we break down the silos of the current model or the focus of the immediate outbreak to some of the aspects more of community responses, social sciences and behavioral sciences, which are so important in the risk communication. So I'm wondering if I can put that question about that kind of connection to MSF and to Michaela from MSF from your experiences. So breaking down the silos and linking some of the boots on the ground to these other disciplines which may be non-traditional in the immediate outbreak response. Michaela?
Yes, thank you. I think the question is very interesting. How do we break those silos? And the silos, one way or the other, are constructed because we are in a rush, because there's a lot of things to do, because we cannot forget the most essential things. But sometimes going so quick make us really respond slower. So sometimes we need to go really think what we want to respond before we respond, and then probably we will catch up. Now, the idea of going out of silos has a lot to do with being conscious that the other ones are complementing the response. You need to be interested on what the other ones are doing, because it can potentially influence how you're going to deliver care. So it's a lot about that institution doing a very specific thing, and how interested is that institution in nourishing or feeding into other aspects of the response that will inevitably influence how the activities will take forward. But if we are in a rush, we tend to forget. So sometimes let's stop for a little second and try to incorporate that knowledge into our own response.
Thank you, Michaela. And can I put the same question to Emanuele? How do we break the silos? So very much in terms of the outbreak response, how do we incorporate behavioral insights and social sciences in the way that we approach addressing the epidemic?
Yeah, I feel that maybe in the past this was not so relevant, and behavioral science and social science were the left child that would come at the end, and what we need to do is to bring it at the front, starting from that while looking at the numbers and immediately bringing in the resources to understand what is happening in the communities where you do have an outbreak. What are the perception? What are the understanding of a new pathogen or an old pathogen? And what are the fears that drive certain behaviors? Mike was talking about the contact tracing and the problems of keeping people in quarantine. We are hearing from our psychosocial support that Red Cross in a number of places, people are afraid to say that they are unable to have the money, and they need to work and to go out because they don't say anything, and they just hide and keep living because they are afraid to say that they are poor. Maybe these are people that have not been poor before. And I think it brings back the need to listen and talk to the people in a way that is culturally sensitive, age appropriate, and it's something that we don't see even in this very COVID pandemic. We don't see enough of. Particularly with the youngsters. I mean, I've seen that we have been failing, I think, if you look at the Western world over the past several months, to find the right language, the right way to bring them in. And it starts with listening, it starts with asking questions. But it requires people that take the time to invest in this. And then that supports the rest. The community feedback systems then support the operation and are not an add-on, are really an integral component of that. And with that, you break the silo somehow.
Thank you very much. And that's a nice segue into the question posed by Pat Drury in the chat, which is really about how can we as GOARN partners, how do we support communities How do we support them to have experts that they can trust? And I'd like to put that question, or the role of trusted experts, I think has been a key one in this epidemic. And I think I'll first go to Rebecca, if I could ask you to comment on that from your perspective. What has been the role of these trusted experts, and how can GOARN partners, what can we do to in a way support communities to have trusted experts?
Thank you. And I do want to build off the last question, because I think that the important thing too is we need to have the behavioral science and social scientists at the table with the people who are doing the contact tracing and the outbreak response as well, because we tend to separate them and say, okay, you work with communities and we'll do this, but they actually go very much together. And the data that feeds to help direct what's going to happen is so critical that they have to be at the table together. And I think that from the Emergency Operations Center all the way down to the community level. And this is where I think also, to Pat's question, is about building the capacity in country as well. We talk about what GOARN needs to do going forward. We need to make sure that's sustainable, because having trusted experts in the community is not something that is developed overnight. And it does require a long-term to build those relationships, as we've heard. And trying to build them while there's an outbreak going on is very, very difficult. So the importance of building that capacity in countries, GOARN's playing that role and leaving sustainable capacity is very valuable. Thank you.
Thank you, Rebecca. And I cannot resist but to ask this question to Mike Ryan also. How can we support communities to have these trusted experts, and breaking down the silos, if you want to comment on that? I think for many, you have been a very trusted voice in this outbreak response. So I'd really be keen to hear your words of advice on that, Mike.
It's a very difficult question in terms of trust. I think the style of communications that's required to build trust is one that's open, that answers the question you're asked, that's not seen to spin, not seen to constantly pivot away from the issue towards what you want to say, and having an open and honest response to people's questions. It's also about using as many channels as possible to generate those discussions, and recognizing that the global press conference or the press release is no longer a way in which you can effectively communicate with ordinary people. We've moved more and more in WHO through the EpiWin network into an information network for epidemics with Unicef, with Red Cross and others, where webinars and reaching out and Facebook Live and TikTok, and really trying to understand what the community is asking, what questions are being asked on social media analysis, and understanding what is driving community concerns and being ahead on that, and then trying to feed information in a positive way to people. So I think, yes, there's an issue of personal leadership and personal style, but it's also, I think there's a whole area opening up now around information management during pandemics or epidemics, infodemic management as it's been coined, right? And that's another area, I think, and that's not just about social and community empowerment and engagement, but you can't empower a community you don't understand. You can't communicate with people if you don't understand what questions they're asking. And sometimes experts make assumptions about community concerns, and they answer the questions that they might have themselves, but very often that's not what communities are actually asking. It's not often what they're most concerned about. As Manuele said, some people are concerned of the shame of having to ask for support during an epidemic. It's an awful shame for some people, so they avoid it and they avoid the whole process. So I think we've made too many assumptions about how our communities think. We've made too many assumptions about what their true concerns are. And we've made too many assumptions about what drives their behavior, particularly amongst youth culture. And I do think that credibility will increase as we understand more about how people think, what their social and sort of psychic constructs of disease are. So we have a lot more learning to do to be credible. But we do need strong public health. This is a time, and I'm sorry to say it quite openly, where politics has crushed public health in many circumstances. And it is time for public health leaders all over the world to stand up for our communities, to stand up for science, to stand up for what is right, and be open to criticism when we do that, and be open to be challenged, and be prepared to be wrong, because no one is right all the time. So I do think we need courage, and we need the courage of our convictions, and we need to do that every day. You know, the price we may pay for that sometimes is our career, but you know, what the hell? At the end of the day, we serve people, right? That's our job, and we need to be ready to fail in that sense. And I think the one thing I've seen in GOARN over the years is the one thing that unites all of the institutions in GOARN is courage. The willingness to put science first, to put evidence first, and to use that to the benefit of the communities we serve.
Thank you, Mike, for that. And I think we've got time. I'll take one more of the questions from the chat. There was a question about how do you address the conflict of interest in terms of serving those communities when the measures you recommend may have negative economic effects that in a way the community feel hurts them, while at the same time obviously offering protective effects. So I'm going to put that question, that difficult question, to Amadou in Senegal. How do you deal with that trade-off in a way when there seems to be conflicting interests for the community? Amadou, over to you.
Thank you. Thanks for these tough questions. But these have been critically something that Senegal had addressed in the sense at some point to say, okay, it's important to have health, but it's important to have economy at the same time. And the only way that this has been addressed has been through a lot of consensus and discussion, trying to spend a lot of time on discussing with people. I mean, at some point, what I think has been extremely important in Senegal is from the beginning, all the community, what we were talking about, the political leaders, religious leaders, came together and said, what should we address? Let's listen to the experts and let's try to manage this as a consensus over time when it comes to tough decision. And at some point, after like several months of very hard circumstances of like restricting movement and people say, okay, the economy is dying, people are going unemployed, what should we do? And then some measure was consensually discussed and adopted, even though everybody was not okay, but the majority of the people were there. So my answer is definitely dialogues, and communication is probably the way to go and build consensus about those tough decisions. And that's exactly what Mike was telling. It's about courage and saying, okay, this is what we think should work for everybody. Let's discuss with us, but this is the way to go. And I think dialogue and courage is probably the way to handle it. Over to you.
Thank you, Amadou. And on that note, courage, on the encouragement for taking courage and leadership from both Mike and Amadou, I'm going to hand back to Dale. There's some questions in the chat, but I think we're running out of time. Dale, back to you. You're mute. You're on mute.
Terrible trap. I wonder if next year I'll be better at that. That's one way I can improve. No, it's been a privilege to co-chair this session with you, Joanna. It's wonderful speakers, insights. What came through was the RCCE and the partnerships came through very strongly, and I liked Sam talking about breaking down the silos, and Mike talking about the RCCE to enable the contact tracing, for instance. So all this about the different silos, if you like, merging a little bit more, and I guess how we implement that more at the ground level rather than sitting and talking about this in the World Health Summit. The need for investment came through. I think that's pretty clear. I do find it a bit amusing when through necessity you can lock down a country and close businesses, but there seems some inability to put that investment into public health capacities, and particularly contact tracing and isolation and quarantine. And I must say, speaking from Asia, I can tell you it's the success of the contact tracing and which led to successful quarantining and isolating positive cases rather than sending them home saying, please don't go out. I think that's been a huge component of the success in Asia, and I believe so in Africa as well. So anyway, it's been my pleasure. I've learned a lot. Back to you, Joanna.
Okay, I just say, God, 20 years, I learned trust, partnership, and courage. And I look forward to the next 20 years. And I was honored to be here today with you. So thank you from Berlin. I really hope you feel as sort of energized by this session as I do. Some fantastic discussions, and look forward to working together with you for the next 20 years.
Won't be me.